ASN President-elect Ronald Falk talks with R. Tyler Miller, Susan E. Quaggin, and Michelle A. Josephson. Friday's presentations provided a range of exciting topics, including new and transformative medical technologies. Don't forget to view meeting photos on the ASN Flickr site and check ASN Twitter and Facebook for comments and assessments from your colleagues attending Kidney Week.
Hello, this is Ron Falk, President-elect of the American Society of Nephrology, and we are now on our second day of Kidney Week, Friday, November the 11th. And with me today are three wonderful individuals, and I'll have them introduce themselves. Michelle.
I'm Michelle Josephson from the University of Chicago.
And you have an expertise in transplantation.
Yes, I'm a transplant nephrologist.
Right. Sue.
I'm Susan Quaggin. I'm from the University of Toronto. I'm a nephrologist and a researcher.
And I'm Tyler Miller from Case Western Reserve on the north coast of the U.S. And I primarily do basic research, but I'm also a section chief at a VA hospital in Cleveland.
So welcome to all of you. It was a wonderful day today at Kidney Week. We heard all sorts of interesting things. What was the one thing you heard today that was most fun or most interesting?
Well, actually, I think the day started out with quite a highlight. I really enjoyed the state-of-the-art presentation by Bob Langer. I thought it was fantastic for a number of reasons. One is he was a great speaker and very funny, very engaging, and really told the story very well. But also, I think he really showed how incredible the interaction can be between technology and biology. It was really phenomenal.
So this was an engineer who has, over the course of many decades, figured out all sorts of applications of polymers in medical uses, from anti-angiogenic factors on polymers in the eye to wafers that could go on brain lesions. It was an astonishing and funny talk.
No, I agree. And actually, I had followed Judah Falkman's work a little bit, so it was really interesting to see the connection and what they had done together.
What I especially enjoyed were the number of times that he went to a grant review process and they told him he couldn't do what he said he was going to do. And then finally, after 20 years later, it was FDA approved. He apparently has all sorts of patents in a number of applications of polymers to medicinal medicine.
Yeah. I wondered where the NIH people were in that talk.
They were in the audience. But it's not the NIH people. It's all of us who sit on study sections who say no to wonderful new ideas.
But, I also spoke to the resiliency that he had. He knew he had a good idea and he wasn't going to give up. He just kept at it.
Self-deprecating to the maximum as well.
Yes.
He also had institutions that would and could support him. That was an important part of it.
Yes.
Right. Sue, what was the highlight of your day?
I think the highlight of my day was the Hot Topics session this morning, which described two very different advances, really, in nephrology. One was looking at the hemolytic uremic syndrome, the Shiga toxin outbreak in Germany, and the other was ablation of renal nerves to treat refractory hypertension. Both parts of the session were outstanding.
So do you think that all of us are now going to want to ablate renal nerves in order to decrease blood pressure?
Well, I think the first speaker gave a terrific introduction and a lot of early data that looks very promising following renal ablation. However, the second talk, the way it was set up this session, they had somebody do an editorial piece afterwards and put in some notes of caution as to how we might interpret the first study. So I think the question is still out there. There's a great clinical trial going on now, Simplicity 3. I think it's going to be very exciting to see how it all turns out.
So if you had hypertension, would you want your renal nerves ablated in 2011?
Well, if it meant I didn't have to take 5 drugs, I think I might go for it. I think one of the big questions is there re-innovation? So that's really a question that's out there. The follow-up hasn't been long enough to see what happens. And in experimental animals, the renal nerves grow back over time.
What happens in transplant patients, Michelle? Do renal nerves grow back?
As I understand, no, they don't. And it's an interesting issue that the transplant is denervated. The patients get hypertension for other reasons, but they are denervated. But there certainly is work looking at taking out kidneys in patients who have native kidneys, in patients who have refractory hypertension prior to transplant if it's not controllable. It's not so much the approach anymore.
Well, that was an old tradition. And in the late 70s, early 80s, there was a lot of work done with renal artery disease where they did what was called bench surgery. And they would actually take the kidney out, repair the medium and small arteries, and then put it back in. It didn't work very well, but it was the principle of taking out the kidney.
Yeah. The other thing that he showed that I thought was very interesting is that there were effects outside blood pressure. So effects on glycemic control, effects on cardiac function, cardiac fibrosis. So I think it's an interesting thing to follow.
And also he thought maybe sleep apnea.
Yes, sleep apnea. That's right.
Renal nerves were a very hot topic in physiology a couple of decades ago, and then it sort of fell out of favor. But this trial and this experience really suggests that renal nerves and feedback loops may have all sorts of implications that we really either forgot or never understood.
I missed that, but did they look at neuroendocrine markers?
I don't
That's
remember.
a good one. They are, and that was one of the things that in follow-up that they need to look at down the road to see if there's reinnovation. I'm not sure if it's the same thing, but looking at norepinephrine spillover from that.
Or angiotensin levels or aldosterone levels, or
I don't
They
remember.
didn't present it.
So what vegetables can I eat? Are any vegetables safe anymore? I thought it was just a raw hamburger I was supposed to avoid.
Bean sprouts.
Stay away from bean sprouts.
That's where the seeds come from. But,
and German bean sprouts.
actually, I think one of the things that came out in the discussion after the hemolytic uremic syndrome was, what about this superbug? So we now have this hypervirulent form of E. coli that carries a new gene that's out there. So one of the questions raised, should we be worried about there's going to be more outbreaks? It's not eradicated. So.
And it's not just a kid disease, because most of the experience that all of us have had recently in North Carolina, again, at our state fair, not this time from the petting zoo, but apparently from someplace else, there were children with diarrhea-associated hemolytic uremic syndrome, some of whom ended up on dialysis, a similar sort of experience, but now in adults. Did they share any reason why adults were the target rather than kids?
Yeah, no, they certainly went through the epidemiology and the fact that females, fairly young adult healthy females, were at risk, and that wasn't answered. That was brought up.
See, I have my theory on that.
Okay, let's hear.
My theory is that more women are going to eat salads.
Well, that was, but they didn't answer it that way. So, but that's
Tyler, what was your favorite session today?
Mine was also the Bob Langer talk. I have an interest in mechanics and biology, and what I've seen is more and more interest in sort of the universe of medical science. As physicians, we often think in terms of really chemical signaling, and he didn't really talk much about this, but I think it fits at the end when he was talking about recreating organs and using scaffolds for growth of cells. There's a lot to the mechanical environment of stem cell niches. And then yesterday, Catalin Shustak was talking about epigenetics and effects on adhesion, which ended up also being mechanical factors. So I found the whole thing that you could synthetically or mechanically provide an appropriate environment for cell growth really fascinating.
And potentially the way to regenerate nerves and blood vessels and perhaps downstream lots of other organs based on a physical scaffold that cells then get to attach to.
Yes. But the cells still seem to know what they want to do when they get there. That's the other very interesting part.
Keep going.
Okay. The scaffolding issue is actually really interesting because I've had an opportunity to hear Doris Taylor, I believe, the woman speak about her work that she's done in hearts. And actually, I think in hearts it's coming along very nicely. And I think it's going to be much harder for the kidney, though, because it's much more complex and you have the scaffolding, but how are you going to have all of the correct approaches?
The heart only has a few cell types, mostly muscle, not all the wonderful, intriguing cells that populate the kidney.
I went to a transplant session on antibody-mediated rejection, and that's because it's becoming such a big issue that those of us in transplant nephrology are dealing with, and also because the technology is changing so much. I thought it would be really helpful to go to an overview session of that. And it was a wonderful session. They talked about all of the approaches towards all the new assays and the history of the assays. They also talked a bit about the pathology and what to look at on biopsies, as well as different clinical approaches. And one of the things which circles back to the talk that we heard earlier in the Hot Topics session, is they also talked about the use of eculizumab in antibody-mediated rejection and how that's starting to be looked at to try to prevent complement destruction of the kidney.
So there were a lot of sessions on complement regulation and complement perturbation of one kind or another. What's, in your mind, the role of an anti-C5 drug in the care of somebody with a transplant?
In that setting where you do have antibody-mediated rejection, it may end up being a very useful drug. I think it's going to be a very small subset of folks, but the transplant community is really struggling with these patients who have antibody-mediated rejection. We're not effectively treating it. And one of the reasons is because I don't think we're controlling the complement destruction that we get. And so this may, in fact, be a very useful approach.
What was the most fun thing you did today, Sue?
Well, the most fun thing I did, maybe downloading the Jason app on the website.
Downloading the Jason app, spoken as a Jason editor. What made you so excited about downloading the app?
Well, that's my first app I've ever downloaded, and but it's a great way to look at the Jason articles, actually, and it's free for the next 80 days to anyone. So you can download it either from the App Store or from the ASN website.
And you can read articles on your phone, on your iPad, whatever you want, right? How long did it take you to download this?
Not that long. I called my son. I got some help.
Anybody under the age of 20. So seriously, how, with all of the multimedia things that are occurring at the American Society of Nephrology, Twitter and Facebook and Flickr and app downloads, how are we going to educate some of our members how to best make use of these offerings?
Great question. I mean, I think probably having some younger ASN members advise us, maybe have that.
So we should all bring our children with us when we come.
Or fellows, and postdocs, and fellows are terrific as well.
Because now you don't have to miss a session since they're downloadable, and of course the abstracts are downloadable as well. So, Ty, what advice would you give to a young person who wants to figure out the best way of wending their way through this meeting?
I like Michelle's idea of doing something new that's a little bit out of your experience. And I think one of the things that's very difficult is trying to go from little bits of things to little bits of things, like session to session to session. So what I try to do is find some place or something that I don't know much about and just sit there and make sure that I listen to it for a period of time. It's sort of like going to a cocktail party. You can say hello to everybody, or you can actually have a useful conversation with a couple of them.
So, Tyler, today is Veterans Day in the United States, Armistice Day elsewhere. You spend a lot of time at VA. Any news or thoughts from this meeting for those who've been in the armed forces?
The VA nephrologists really are a large group at this meeting. I think there were probably 200 who come. And we all pay special attention to dialysis and to care of patients with diabetes and hypertension.
What did you think about the potential applicability of some of Langer's work in the future with respect to spinal cord injuries and or amputations and other such with trying to do regeneration?
Well, certainly the spinal cord and neural injuries were fascinating because that's the biggest problem of people coming back from Iraq and Afghanistan.
There were two things in that talk. One was the effort to be able to regrow an ear we saw, a nose we saw, different shapes of a nose, but presumably people who've been injured could make use of that technology. And the other really pretty phenomenal example was one you just related, primates and rodents who had spinal cord injury really seemed to be made much better. At least in animals, this appeared to be made much better by the technology that he's developing. So it's 2011, so it's going to be 2031, and I'm going to be doddering around, hopefully, in one way or the other. What's the practice of nephrology going to be like based on what you heard today?
Well, one of the sessions that I went to, and I've heard quite a bit about at this meeting, which I didn't know about before, is microparticles and the role of microparticles in both diagnosis, prognosis, disease progression. I thought it was fascinating, but it's clear that we're still at a very early stage of understanding what they do. So we can identify them, and there were a number of talks today talking about microparticles made from endothelial cells, neutrophils, from podocytes, things that actually play a role in ANCA vasculitis, a very important disease. But it's clear that we don't know if they're bad or if they're good. We can perhaps remove them with plasmapheresis and current therapies. But even the half-life and what they actually mean isn't known, but we can measure them.
And interesting, with a microparticle, they may actually be able to get inside of another cell and change the machinery of that other cell, either by interacting with message or perhaps by protein expression.
If you think back 20 years, you think back to 1991, you think about the transplant medications and drugs that we used, they weren't that much different. I think actually potentially 20 years from now, we are going to be looking at a whole new paradigm, different approach, use of biologics, things that are a bit different than we're doing now. And hopefully, potentially, even we will have made some progress in tolerance.
I wonder, too, what renal disease will be in 20 years. What renal disease is, or what nephrologists do, is changed because of the population. The dialysis population now is very different from what it was 20 years ago, and my guess is it will be different again in the future. And as Joe Bonventry was talking about yesterday, what's considered within the purview of nephrology was different 20 years ago, and it probably will be again in the future. And I agree that there are things, what we're trying to talk about here is things that will be new and interesting and give nephrology life, so that it will be an exciting field. And I think things like the complement pathway, to the extent that we can make that nephrology, will be in good shape.
Well, thank all of you for spending this evening with us. This is Ron Falk for the American Society of Nephrology.